Hi, I'm Dr. Muralidhara K. I'm the consultant and head of the department Emergency Medicine, Narayana Hospital's HSR level, Bangalore. Here we treat all kind of emergencies, including cardiac emergencies, neuro emergencies, and trauma patients. Cardiac emergencies are our specialty. We have a very good cardiac team here. So initially, any patient who present with chest pain, breathing difficulty, giddiness, or any of the chest symptoms, the patients will be evaluated within no time. Within 2 minutes, we get all the ECG and we analyze the ECG, and whatever the initial treatment or stabilization is required, that we do, and within no time cardiologist will be called in for further cardiac workup and cath lab procedures. We do receive a lot of trauma patients as well, usually polytrauma or orthopedic trauma patients. We have very good orthopedic consultants who are available around the clock. So very experienced orthopedic surgeons they are present here. So initially, whatever ortho cases we receive, it will be stabilized here in ER, and then X-rays are done within no time, and X-rays are splinted, and even if cast is required, they're applied, and the consultant is called in for further management. Another plus point of our hospital is we have in-house sports medicine specialist. We do cater for all sports injuries, and the initial stabilization, of course, will be done in ER department. Later, the specialist will be called for further care. Whenever we receive acute patients, especially cardiac arrest or peri-arrest patients, we initiate all the Code Blue protocol here. So Code Blue means any patient who is in arrest or in peri-arrest, such patients will be resuscitated in our hospital without any delay. So such patients will be initially given CPR, and CPR is life-saving technique, and we have started an initiative to train this hands-on CPR in the community as well. First, we have started with training of police personnel, especially traffic police, because they are the first point of contact. After that, we have started with gym facilities, where we have seen recently a lot of fit persons undergoing this cardiac ailments. For that, we have started with the gym personnel being trained in CPR techniques. And later, like now, we have extended our CPR training skills, even awareness programs, to all the apartment complexes. And even the school premises also, we have initiated this program. I think everybody should learn CPR. Everybody should know how to give CPR. This is a very good life-saving skill and a tool. We have in-house neurologist. And whenever there is an acute stroke, how to recognize this acute stroke. Very simple technique. We use a technique called as FAST. FAST means, F stands for facial drooping, A stands for arm weakness, S stands for speech abnormality, T is time. Why T is included here? Because any stroke, time is very important. We call brain is time, means the more time we lose, we are going to lose more neurons. And that is why we have introduced this FAST technique, where the stroke is recognized very early, and we have something called a stroke pathway here, wherein within no time a patient will be assessed, and the imaging will be done, and if thrombolysis is required, we do the thrombolysis in the ER department itself, and our neurologist will take care of this acute strokes well, and if any interventions are required, we have very well experienced and neuro intervention team in our main NH. Whenever you have an emergency, please call our emergency number or you can call to 108. This is the National Ambulance Service number. So once you see the patient is say unresponsive, please check the response. How to check the response? You can hold the shoulders of the victim and slightly you can shake and shout at him. If the patient is not responding, that means patient is having definitely some serious illness. You can check the pulse. The central pulse, carotid pulse, you can check. If the pulse, if you cannot check the pulse, that is also fine. But say you can call the nearby ambulance, and meanwhile, if somebody is aware of this CPR technique, if patient is in say arrest or peri-arrest, they can initiate the process. They can initiate CPR technique, and they can wait for the ambulance to come and help the victim.